Hey guys, this is John Adamson, the Rehab Documentation Guru. For those 304 subscribers that I have, I want to thank you. It's been probably 2 years or so since I posted any content. I'm going to try to get back to that. Been busy with a lot of stuff. And no, I don't wear purple eyeliner. I've got blue light blocking glasses that for some reason like to reflect purple. So you can probably see that in the video. But I wanted to talk to you for a moment about Targeted Probe and Educate. For those of you that haven't heard about it, feel happy that you are blissfully unaware. But this is a Medicare program. It's been going on for several months now. And basically what's going on is this. Medicare is allowed to target 20 to 40 charts, patient charts, where they can target an individual provider of therapy services. And what they'll do is they'll send you a list of charts that you need to send into them with date ranges. And what they're doing is they are fishing for denials. That can't be denied. And the other thing that what they're supposed to be doing is they're targeting for specific concerns that they're seeing in billing practices, and they're looking to do what it says. They probe, they review the documentation, and then they educate. And this can go up to 3 rounds for an individual billing entity. So let's say you work for a skilled nursing facility or an outpatient clinic, and you get a Targeted Probe and Educate, and you send them your charts. If they don't like what they're seeing, they will then send you through another round. And it can go up to 3 times, and they're supposed to provide education during that time. If they still don't like what they're seeing, then you're going to possibly face some serious issues. These Targeted Probe and Educate will lead to denials if they find cause to deny your medical necessity. And so they can be hugely financially impactful. Let me tell you the 2 main things that we're seeing, and I am in the appeals management world, that the Targeted Probe and Educate is focusing on. Number 1, high-level patients. So these are the patients that are starting off with you that are already Contact Guard, MinAssist, and better for all their functionality. And you keep them on for a little while. Those patients already look like they're high level. Yeah, they probably could be taught home exercise programs, compensation techniques, probably, according to Medicare, don't need much therapy. One of the ways that you can combat that is this. A nurse reviewer does not know all the things that you as a therapist address. And if you've been to my course, we learn to distinguish between functional deficits and underlying impairments. So while the patient might be functionally, let's say, Contact Guard, maybe, for example, on their Tinetti balance and gait score, they scored a 15 out of 28. That 15 out of 28 would represent a lot of underlying impairments, several gait and balance components that need to be addressed, and might take a while to move them from what's high fall risk to low fall risk. And so what you need to do in those cases is delve deep into the underlying impairments and use those standardized tests, because Contact Guard, MinAssist does not tell you much in the way of anything. Standardized tests is where it's at. And so you really need to have those standardized tests to help back up the reasonableness, the outcomes-based measures related to your claim. The second most important thing for Targeted Probe and Educate is skilled services. What did you do? What did you bill? And you want to always base that upon, number 1, your skills related to the interventions you're doing. So, for example, Therex is an easy one to talk about. Therex's definition targets 4 areas. Number 1, strength. 2, range of motion. 3, flexibility. 4, endurance. Those are the 4 things that it targets. You must demonstrate that there's an issue in one of those target areas objectively, measurably. Too many therapists don't measure things properly. And then you've got to show that it takes your skill, your knowledge, with your licensure to bill for that particular problem. So that's one thing you got to do. Number two, always document your skilled services, either on a daily note if you do them, or on weekly notes or whatever you do, with full statements, full sentences. Sound professional. And this is the format you want to use. You want to use, number one, the name of the CPT code you're billing, so that you alert the reviewer, this is what you're going to be looking for now. Mindful of the actual definition of the CPT code. And you can find that through a Google search pretty easily. Number two, you want it to be clear that what you're billing is what you did, not what the patient did. So it doesn't, partly it doesn't matter that the patient did 3 sets of whatever with such and such an exercise. What matters is, did they need your skill? So the action person, the person that's doing the action in the skilled service is you. So make that clear by using action words associated with what the therapist did. Next, you want to target. What was the target of your action? Was it an anatomical target? Be specific. Utilize that skilled terminology you learned back in school. Also, the target of the CPT code, very important. Make sure you define it. Also, you want to talk about any response that the patient has to the intervention. So it could be a subjective or objective, but it always should be measurable. And that's important. And then lastly, you want to really document, before lastly, special techniques. Things like joint mobilization. I use that often. What technique did you do that somebody that's not skilled could not do? And then lastly, evolution of care over time. One of the things that Medicare often dings people on is repetitive care. And so look at your notes, especially a patient you already have established. If you can go from note to note to note, and the patient is getting the same thing word for word, every single note, that's what we call repetitive care. And Medicare will ding you on it every single time. So make sure over time it's clear. Part of your skill is evolving the care or adjusting it in response to how the patient's doing. So those are the main things that the TPEs that we're seeing come through are really targeting high-level patients. So prove that you need to see them with those underlying impairments and those standardized tests, and also the skill of a therapist. Thanks for tuning in. If you're watching this video, my name is John Adamson. If you like my content, there's a lot more in my courses, obviously. I teach for Summit Professional Education, a course called Documentation Bootcamp. Also online, they have available a 1 credit hour PT-only ethics course that I've developed. And then also I teach for an entity called Allied Health Education. And they have 2-hour webinars. I have one called Documentation Dynamics, or Documentation Essentials, I'm sorry. And that's a 2-hour course. It's a abbreviated version of my Documentation Bootcamp with Summit. Also, I teach a course called Neuromuscular Reeducation, which is designed to help you get paid for neuromuscular reed. Goes over everything you need, basically, to prove the medical necessity of neuromuscular. Coming out soon with one on therapeutic exercise. And anyway, my goal is to help you get paid for what you do. So again, this is John Adamson, the rehab documentation guru, signing out for now. Thanks for watching.